So the argument is that everything centers on patient care. So when we're in the hospital setting, everything that we're doing is in some way motivated by the care that the patient's receiving, right? We're in a service industry. They talk about hospitals being part of a service industry. That's important for us too, because if we're thinking about the registry, or if we're thinking about things like policy at the hospital or leadership concerns at the hospital, again, everything is centered on patient care. So for the registry, every single question that we receive in some way is going to have patient care kind of underscoring the correct answer. Because what's going to happen is when you're taking your tests, your respective board tests, they're going to ask you a question, and there's going to be a series of answers, and one of them might be correct, right? One of them might be more correct. And typically the more correct, is that correct? Is it corrector or more correct? I don't know. Typically, whichever one is the most correct, the correctest, is going to have patient care in it, right? So I think that's a good place for us to begin. So again, it's going to improve patient safety if we're able to talk to them appropriately, make sure that our patients keep coming back, for repeat referrals. One of the things I've really found, and I found this particularly when I was working as a radiation therapist, is there's been a lot of research out there too about this. Better staff morale, right? If you're communicating with your patients in a way that's appropriate and fun and insightful, typically that whole department's going to be functioning better, right? Another thing that she mentions is that in addition to patient satisfaction being increased, we might actually wind up decreasing the amount of time that we spend doing other things, right? So the actual exam time might decrease if we're able to communicate appropriately with the patient, right? If we're using communication windows appropriately, if we're making sure that the patient's educated, that they're part of the decision-making process, we can actually, it seems like we're taking more time, but we can actually be more efficient, right? Okay. So, one of the things that's really, really tricky about talking to folks is you can't really communicate meaning, right? You can't really tell someone what I mean. I think about that a lot. I'm married. I've been married now for 17 years. We had an anniversary over the break. But one of the real struggles once you've been married for a while is realizing this person, I know this person really well, but I will never completely know them, and they will never completely know me, right? That's kind of humbling when you think about it. So, for example, with my wife and I, we had some questions last night. I'll put it mildly. We had some questions last night about how best to work with my son Solomon and the foster kid that we have in our house right now. They were playing with some trains and they were arguing and fighting and stuff. She had one way of dealing with the situation. I had a different way of dealing with the situation. And as we were trying to figure out how best to deal with the situation, we butted heads, me and her, a little bit. And it was because of this issue of how meaning works, right? So when we're working with our patients and we communicate one thing, we mean one thing. When we're talking to them, they might be receiving something totally different, right? When I say lay down on this table, we're going to do some pictures. Let's say I just rushed this young lady in here. I say jump on the table. We're going to get this done really quick, right? Who knows what that conveys to her? For me, that means I'm trying to get your exam done so that we can get you some results as quickly as possible. But for her, if she's coming from a past like of a hard place, or she's been mishandled by a man before, or whatever other meaning she might come, that very, very innocent request of asking her to get on the table might have all sorts of other implications to her, right? So one of the things that's really, really important is that 40 to 60% of the message's meaning might be lost just in communicating to someone. So what are we going to do about that? We got some barriers here that we've got to overcome. Language, power struggles, right? Who here has ever had a patient who says they hate doctors? Yeah? I hate hospitals. I hate doctors. Don't come near me, right? I had one guy, I was trying to start an IV on him. He swung on me. He tried to punch me. It's like, dude, I got a needle in your vein. Like, that's not smart. But there was a power struggle there. Just misreading body language, right? I think about that. That can be, when I worked out west, there was a lot more native peoples, out west, Navajo, and just Utes and a bunch of different kinds of native folks. It's disrespectful to make eye contact for a long time with them. That's culturally how they grow up, right? And if I was like a village elder or something, I could make eye contact with someone, and that's kind of a way of putting them in their place, right? But as a healthcare professional, if I walk into the room and this is an older man that I'm treating for prostate cancer or whatever, he would totally not appreciate. It would be disrespectful to him if I come in there and I'm just staring him in the eyes the whole time. Even though in America that means that I've got your full attention, right? So body language kind of stuff. Can anyone think of any other examples of where body language might get misread?
Say you're listening to somebody talk and you're doing other things.
That's a big one, yeah. Yeah.
Even if you're just setting up a machine. I've had a couple where I'll be moving a tube over a patient while they're talking to me and they'll stop.
Yeah.
And I'll be like, what were you saying? And they're like, oh, well, you weren't listening to me. So you've got to kind of tell them you're either going to do it while you're listening or...
Yeah. Yeah, that's a really good point. I used to prime my injector while I was communicating with the patient, getting some of their history and stuff. And I'd have to turn my back on them and give my attention primarily to this power injector, right? But I'd always make sure, like Dustin's saying, to communicate to them, hey, look, I'm still listening. I just got to make sure this thing's ready to go, right? Keep talking, please. So when I see the word cultural differences, a lot of times we think, the culture between like North Korea and South Korea or something like that. But culture can be something as simple as the way that you were raised in your house, right? Like, for example, in my house, my dad was a doctor, and so the culture of my house was he was there for family meals, but not all the time, right? Or he would be there at a baseball game, but not all the time, right? So that's one example of a culture in someone's house. Another family that maybe the dad's there all the time, the mom's not always there, right? Maybe neither parents are able to make it to those things, right? Maybe both do. I would say that is a family culture, right? And so that kind of way of being enculturated can influence the way that we work with our patients. So let's talk about some of the things that we can use. This is like our toolbox of ways we've got these struggles. We know that a lot is lost in translation. We've got these barriers to communication. Let's talk about what tools we can use to kind of do that. Eye contact, I think, is important. If you're dealing with a culture that is not familiar with eye contact or they don't appreciate eye contact, does anyone know what cultures that would be in addition to Native American cultures? Possibly. Chinese sometimes don't appreciate it. It just depends on, but I would say on a whole, if we're here in America, on the whole, people have learned to trust eye contact. They appreciate eye contact. You will know pretty quickly if someone's not accustomed to it, Just be aware of it. Be aware of your posture, right? What does your posture say about your professionalism? I would say within a fraction of a second of me walking into a room, they have already formed some kind of subliminal estimation of what kind of person I am, right? And I'm doing the same thing. And if we can train our brains to be aware of that, you can pick up on a lot of stuff. Just the way someone is sitting, are they clenching their fists? Are they clenching their teeth? Are they rubbing their forehead? Those kinds of things communicate a lot, and ditto for me, right? Tactile stuff. And I would say maybe go a little easy on this, but they talk a lot about the healing touch, right? What are populations where it might be appropriate to use healing touch, like a touch on someone's shoulder as we're communicating with them? What's a population that appreciates that we communicate with every day? Children appreciate it. Good. Elderly. Yeah. An 18-year-old girl, I probably don't need to go in there and start touching her shoulder, right? So it's one of those things you have to use a little bit of your street smarts to figure out, is this person anticipating or actually needing some kind of encouraging touch? Kids, it's a big thing. One of the things we talk about when I'm doing counseling with the foster kids and stuff is 2 hands and 2 eyes, right? I'd like to see 2 hands and 2 eyes. And if you can get a hold of that kid's hands and get eye contact with them and just say something like, I think you're amazing. I love spending time with you. That validation goes a long way. That they are going to trust you more, right? They need to know that they are seen and that their needs are being felt. So often in the healthcare setting, we roll into a room, just start doing whatever we're doing. The kid flips out. You know, they don't feel safe. I know they're safe. Mom knows they're safe. Everyone knows they're safe. They don't feel it. So they do that fight, flight, or freeze thing where they just flip out, right? Or they shut down, you know, where they get combative. But using eye contact, using a handhold with a kid can be a very positive thing. It's important to get down on their level if you're going to be communicating with them. Hit a knee and say, hey man, I know this is a hard day. I'm sorry that you're here at the hospital, but you're a tough guy, and we can get through this together, you know. With the kids especially, if they're hurting, I don't need to try to reason with them, which is one of the hardest things about communicating with kids. The portion of their brain that is responsible for language and logic is not fully developed. It's actually not fully developed until we're 25 years of age, right? Language and logic is not fully developed in kids prior to 25 years of age. This is what neuroscience is telling us. So if I'm trying to reason with a kid, I'm going to say, okay, we're going to go in there. There's going to be this machine that uses x-rays, and we're going to get you to lay on a table, and they hear wah, 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 right? What I need to do is get their trust with a handhold and an eye contact. Say, hey man, I know you're hurting today. Tell me how you're doing. Gosh, that's rough, right? Keeping that eye contact with them. And then I will make it as simple as possible. Here's the rules for what we're going to do. We're going to stick together, no hurts, have fun. Stick together, no hurts, have fun. They don't need to know how the machine works. They don't need to know any of that stuff. But if I can consistently just use a very simple way of touching base with them, hey man, I need you to stick together with me. I'm going to put this lead apron over you. Right? Isn't that nice? Keep you safe. There's not going to be any hurts in here, right? If I can say that honestly. We're just going to get a picture of your head. Look at this robot. Look at this giant robotic donut thing. Pretty fun, right? So yeah. All right. Intonation is important too. Yeah, I think we've all got a grip on that. People can be very aware of their personal space, right? And we've all got some form of personal space. Be aware of that. At some point in your career, you're probably going to be well inside of someone's personal space, and it's not going to be good for either one of y'all, but it has to kind of happen. So I would continue to communicate at that point in some way, shape, or form. Do you have a story on that?
Yeah. So we were doing, this guy was getting a hip injection, and you know, you have to clear the hair off the area. So I was responsible for doing that. And I just couldn't communicate. All I could do was just keep my eyes on that spot, and then he was just kind of like frozen. Like, I don't know how to make that not awkward, because it's awkward.
I think telling folks straight up, some of what we're doing today is a little different than what you might normally be accustomed to. I want you to, know that we're going to practice professionalism. I'll do everything I need to do. Everything that happens in this room stays in this room. I'll let people know if something seemed awkward, And I will make sure that I have their consent along each part of the process, verbal consent. All right, sir, I need you to drop your trousers, okay? Will you please drop your trousers for me? All right, sir, I need you to go ahead and drop your underwear too. I know this is kind of crazy, but this is what we got to do to get this injection done, right? And if there's a part of it where I sense some hesitation, I'll say, hey, how are you feeling right now? What can I do to help you out? Do you want me to cover you or something like that? Let me know. I'm here to do everything I can to make this easy on you. One thing you can tell folks, especially with the radiation therapy patients, is I cannot always maintain your modesty, but I can maintain your dignity. I'm going to need to look at the area that we're treating pretty closely, and you're going to think I'm staring at you, but I'm just trying to make sure everything's lined up, right? So even preempt it in some way. Sir, I got to see this area that we're working on today. I can't maintain your modesty here, but I'll maintain your dignity. I'll keep you covered up as much as I can. Okay, that's a tough one though, I agree. Okay, do your best to be audible. Who here knows about therapist voice, mommy voice, daddy voice, that kind of stuff? Your voice, the police will tell you your voice is probably your number one first weapon. The way you articulate, the way that you communicate to people, they immediately are sizing that up. Especially those patients who are ETOH or there's any kind of power struggle thing going on. Get out that mommy voice. Get out that daddy voice, right? If you have a patient who's having a seizure, though, right, or they're in the middle of some kind of mental collapse, probably don't need to be using daddy voice on that person, right? I can probably be whispering to that person, hey, I'm here. It's okay. It's okay. It's okay, right? So recognize that as we're communicating with them, if they can see us, if they can see my face, if I can do everything I can, you little kyphotic old lady who's facing the floor her whole life, you're going to get down on your knees and look up in her face, right? That's the number one way you can make her day. Let them know if you can't hear them. It's a way of showing that you're attentive to what they're saying. Let them know if you're unclear on something. I'm not sure what you meant by that. Can you tell me a little bit more about that? Now, I don't necessarily need all their family history. You got some people who are like poor historians because there's nothing. Why are you here at the hospital? I don't know. Then you got some people who are like, why are you here at the hospital? Well, it started in December and my uncle came over and he was like, let's go try out this new corn dog. And I was like, sir, why are you here today? Right. It's not, I don't think it's rude to interrupt someone if you do it with a smile on your face, personally. That might be a cultural difference, but if I'm trying to get through some stuff pretty quickly, I think that you're allowed a certain number of interruptions. I've yet to have someone go ballistic on me for interruption number one, right? So I'll test the water with that. Sir, today, why are we here at the hospital today? What's going on today? Right? It actually is not helpful to tell somebody, I've got a lot of other patients waiting. Probably communication no-no number one, right? Because that communicates a whole lot else to that person. You're not important. I've got a lot of stuff I need to do. You're wasting my time, right? But you can communicate to them that, like, in order to get this exam done efficiently, right, and get you the best results possible, I need you to give me some really consistent, really to-the-point explanations, right? I'm going to do this the best that I can for you. It's probably the best thing to say. Okay. Okay. Don't tell people everything's going to be okay. Don't tell them have a nice day. I don't. If you've got terminal cancer, you're not going to have a nice day. If you've got tertiary syphilis, like, nothing seems good to you, right? if there's anything I can do to make them better. So the best thing I can say to a person when I'm done with their CT scan is what?
Hope you get to feeling better.
Take care.
Thank you.
I'll pray for you.
Thank you. Thank you for letting me take care of you today. There are some people who honestly, if you say, I hope you get feeling better, they will probably say, I want to die. I've had someone say that to me. Like, I am so done. I'm so done. So the best thing I can say to them is thank you for letting me take care of you today. It's been an honor, right? And just leave it at that. And a lot of times they'll thank you in return. Don't ignore a patient's wishes. If they're cold, get them a blanket. You know, you can learn a little bit of Spanish. One of them is hace frío, right?
It's cold.
Yeah. Are you feeling cold? You know, is it cold? Hace frío. I don't need to know. They can just say sí or no, and I know this person needs a blanket or they don't need a blanket, right? So knowing just enough Spanish to kind of communicate with someone and make sure that their wishes are being met during it is helpful. A lot of this stuff's pretty obvious. Avoid medical lingo. Don't ever blame the patient. It's apparent. Practice good listening. It's amazing what people will tell you if you're listening attentively. It's really, sometimes, it's one of the weird privileges of the job. One of the things that I've read in some of my reading is in terms of developing a rapport with someone, right? I have done some crazy stuff to get a rapport with someone, right? When we're working with CT patients, we will have patients who just had a seizure, who have Alzheimer's, or who have been hit in the head repeatedly through a car accident. They may not be in their best frame of mind, is what I'm saying. Developing a rapport with that person is absolutely essential if you expect them to hold still for the 15 minutes or whatever it takes to get a scan of their head. It's absolutely essential. So I have said to older ladies, yes, Grandma. Grandma, it's Benny. I'm here to do your CT scan. Please hold still. Do you remember that time we did this, this, and this? I will make up stories. If it's clear to me that someone has Alzheimer's, I will make up positive associations for them. Right? Am I lying to that person? No, I'm not. I understand where they're coming from, and if they start to have a series of negative associations, they will get violent. Right? That is just the nature of that disease. My grandfather had it. I think my grandmother's struggling with it now. So make up positive associations with someone. Recognize that they might see through it at some point, and then you can that house of cards can crumble pretty quickly. So recognize that is a tricky little technique sometimes, right? I wouldn't go full bore on it, is what I'm saying. I've found that depending on different communities, they may appreciate some kind of familiar address. Being called grandma, being called grandpa. They know I'm not their grandson, clearly. You know, I might not even be the same color as them, but they appreciate that marker of respect, right? Other examples of weird developing rapport. With drunk people, I will act slightly drunk, right? I guarantee it because it gets the job done. I am kind of a social chameleon. I will do whatever I can to meet that person where they're at. If they look like my cousin, I will tell them, you look like my cousin. If I look like their cousin, I will ask what that cousin's name is, and I will start to talk about that cousin some, ask questions about that cousin, right? Why? Because what I've found in my research is that, again, if they recognize, if there's a family similarity between me and someone else, or if I have a family similarity between someone and their family, that rapport happens much more quickly, right? So I'm not saying be a sociopath or anything, but I am saying use whatever tricks you've got in your book. Questions about that? Okay. Let me see. We've got just one more. Okay. Explain everything before you do anything. if you're dealing with adults. It might not work with kids, right? We're going to go into this room, we're going to get a picture. That's all a kid needs to know. Give them opportunities to ask questions. You know, any questions at this point? I know we've gone over a lot of material. Think it over. Do you have any questions for me? Use reflective speech. So that's like, patient tells me, I was in a car accident and I got in a fight with my boyfriend last night and blah, 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 blah. Reflective speech is me saying, okay, what I hear you saying is that last night you were in a fight, and maybe that was a little distracting for you, but at any rate, this morning you were in a car accident. And did you hit your head? Did you hit your head while you were in the car accident? So using that language where I say, I heard you say this. This is what I understand you just said. It seems like infantile, but it is so, so, so important to tell someone, this is what I heard you say. And they're like, no, that's not what I mean at all. You know, I mean, blah, 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 this, and this. Okay, thank you. Thank you for helping me clarify that. And I think that's it. Is that all I have?